Thank you guys for being here. I'm so sorry I wasn't able to be here this morning because I really would have liked to hear Dr. Fisher talk. We've shared some patients over the years, and I think he does wonderful, wonderful things with patients. So I'm here today to talk to you about integrative medicine. And first of all, here's kind of the questions that I thought this audience might be interested in. What the health is integrative medicine? What's the integrative medicine program at University of Colorado Hospital? How might integrative medicine be helpful for people with scleroderma? And certainly, where can you get more information? So I've got 45 minutes to talk on a pretty broad topic. And so I wanted to make sure that I left you, and the slides at the very end I'm not going to go through, but that's basically where your resources are, where you can find some trustworthy information about integrative medicine. So first of all, definitions. When people hear there's a talk on integrative or alternative medicine, a lot of times they expect the speaker to come looking like this. But really, I don't often dress like that. Sometimes at work I'll put on my witch doctor costume. But basically, the first term on the block to describe therapies not historically found in a U.S. hospital or historically taught in a U.S. med school was alternative medicine. And this reflected therapies like acupuncture, chiropractic, and massage. But then they did surveys and they found that most people who were using these so-called alternatives really weren't using them as alternatives, but they were using them along with conventional Western medicine. And so that's why the term complementary came about. And I do always like to point out that complementary is spelled with an E and not an I, because if you spell it with an I, what does that mean? Complement, and hopefully all of your doctors are practicing complementary medicine and telling you, you look nice today, great job on dropping 5 pounds, that kind of thing. What else does it mean when you spell it with an I? Free. And are these therapies free? No. No, that's one of the issues with alternative and complementary medicines. They're far from free, but complementary in this way reflects that most patients who use them are using them alongside of conventional Western medicine. And then the new term on the block is integrative medicine, and that reflects when maybe you're seeing the acupuncturist and seeing the physician and they're talking to each other. So the integration of care is something I believe strongly in, and that's what we're trying to do at University of Colorado Hospital for sure. And I think that's the safest and most effective way to practice it. There's also lifestyle medicine to talk about. So with lifestyle medicine, it's the use of stress reduction, good sleep, nutrition, mind-body therapies, things that basically you can do for yourself, using those along with the alternatives and the conventional care. So integrative medicine is coordinating all of these things. So a little bit of an advertisement for those of you who are living in the Denver metro area, just to tell you what's going on at University of Colorado Hospital with integrative medicine. And Cindy nicely put a packet of materials in everybody's handout, so if you want to know more information about us, there's a packet of information about who we are and what we do. But basically, we've got some different locations affiliated with the hospital, and we're moving our main clinic from the main hospital campus to Stapleton. November 10th is our first day there, so it's going to mean a whole lot. How many of you guys have been out to the Anschutz Medical Campus? How's the parking? So it'll be more convenient that we're going to be at Stapleton, and we'll still be integrated because we're still using the same medical record. You can still email and pick up the phone. But our main clinic is going to be off-site. Anybody been to integrative medicine? One? Okay, so you get all the questions at the end. Basically, these are the services we offer. You can see we have just a general assessment and an overview. So that's me, and our PA does the same thing that I do, which is people going, what else is there? What else can I do besides take medications, have surgery? That might improve my health. And then we have traditional Chinese medicine, massage therapy. We have a dietitian who talks about food as medicine. We have a pharmacist who does Western herb and supplement counseling and also makes sure no drug interactions with herbs and things like that. We have a chiropractor. We have a number of psychologists who are health behavior psychologists. You're going to hear a little bit more about that, I believe, from Dr. Kilborn in the next talk. We have a physical therapist who does what I call woo-woo physical therapy, because he went to Naropa University and got a psychology background there first, and then he went to physical therapy school. So he kind of takes PT and puts it like this and puts a definite mind-body spin on it. So for my patients who tell me that PT hurts, He's the perfect answer because he's very gentle. I'm going to hurt myself and need Marcus if I keep stepping in these little holes. And then we have a yoga therapist who does one-on-one yoga. So for people who want to try yoga, but the classes are a little bit intimidating or maybe potentially harmful if you can't, tell the instructor everything that you've got going on, she's a great way to get comfortable with yoga and then go on into classes and doing it on your own. So using an integrative approach, I have some simple steps to follow. One is to avoid harmful practices. Number two is to focus on things that you can do for yourself. And I think this is especially important when you're living with a chronic illness because a lot of times people tell me they feel like they've got no control. They're sort of at the mercy of the healthcare system. And by focusing on things you can do for yourself, this is one way to get some of the control back. I like to discuss things that are safe and plausible and then consider referring people out for therapies that we don't offer, or if they need some different conventional care, I like to make referrals there as well. And everybody in our program, our number one goal is to return the care of the patient to the patient. So if acupuncture is working, our acupuncturists teach people acupressure points to use. If massage therapy is helpful, they might bring us in a spouse or significant other to show them how to get to be able to do some nice massage without getting carpal tunnel syndrome from doing it wrong or something like that. So ultimately, we like to make sure that people are just learning tools and building tools when they come to see us. So just a brief note on therapies that I consider to be harmful, and I've just got this slide. This was the cover of Weekly World News, like 1990 or something like that. Princess Di was on the cover, and it says, Di cures all her ills with weird water therapy. She has her bowels washed out with 12 gallons of water 3 times a week. Now she's free from tiredness, anorexia, headaches, allergies, depression, and candida. So what was Princess Di doing?
Purging.
Yeah, colonics, purging, yeah, so colon hydrotherapy. So certainly there's a role in conventional medicine that you might want to clean your colon out, like if you're going to have a colonoscopy, or maybe if you've got some super constipation problems. I love talking about stuff like this after lunch. just
Glad it's not before lunch.
Yeah, probably, right. We would have had more leftovers for lunch. But so she was doing this colon hydrotherapy, and there's not a lot of plausibility behind it. So you hear these commercials, like late night commercials, and they say, John Wayne died with 10 pounds of undigested fecal material in his colon, and you think, wow, if he'd had his colon cleansed, maybe he'd still be alive, And they show you these pictures where your colon looks like a gunked up sewer pipe with hard water deposits, and that's just not reality. And and now we're realizing how important it is to have all those good bacteria in the gut and how much good they do in terms of keeping your health and so forth. And why would you want to just rinse all those guys out like Princess Di was doing? But there's certainly a lot of potential safety issues with colon hydrotherapy. So if you think back to your high school chemistry days, if you have a saltwater fish and you drop it in fresh water, what happens to the fish? Same kind of thing when you've got this hypotonic solution like water goes inside your colon and can diffuse across the membrane into your blood. Basically dilute your blood so people can get very low sodium levels by doing the colonic hydrotherapy. Can you guys think of some other risks? Infection, yeah. So there was a guy in Montrose who, 20 years ago I think it was, but people were coming from all over the country to see this guy, had this outbreak of a really strange amoeba infection that got the CDC involved because people were turning up in Texas and New York in places with this strange amoeba infection. So turns out he wasn't cleaning his equipment properly. It's a good after lunch discussion.
Yeah.
Yeah, I got appendicitis.
You got appendicitis?
And had to have my gallbladder removed.
Wow, so you've got less parts. Yeah, so you did lighten up a lot, I'm sure. Yeah, parts in a bucket will lighten you up. And then just perforation is another potential risk too. Just putting a large volume in a not entirely, I mean, it expands quite a bit, but not that much. So, no plausibility behind colon cleanses, no reason to think they'd be helpful, and certainly a lot of potential harm. So I do like to get up on my soapbox and try to talk people out of colon hydrotherapy, for example. And then what's this plant?
Poison ivy?
Yes, so that's natural. Is it safe?
No. It's got poison in it.
Yeah, so
poinsettias and
yeah,
other
tobacco. So, you hear that as a way to sell supplements a lot. They say it's natural, so it's safe. Well, not always true, so just keep that in mind. And then there are a few other things on my hit list, but for time's sake, I'm not going to go off more on those, just picking the interesting ones. But I do like to highlight this financial toxicity because, as I brought up before, a lot of these therapies cost money. They're not always covered by insurance, and people can spend an arm and a leg. So I like for people to be very mindful about the therapies they're choosing. And for any hands-on therapy like acupuncture, chiropractic, or massage, kind of have in mind, once a week visit for 5 weeks is a good trial. So if you've gone 5 weeks and you've noticed no benefit for whatever problem you were trying to address, that's a good trial, and just kind of cut your losses. If it's helping you, then try to space out the time between visits. Go from once a week to once every couple of weeks. Make sure you're learning things you can do on your own at home. And ultimately, maybe you're coming once a month or just coming when you need it. And then certainly anything that's used in place of a curative conventional treatment. There's another. Take your shoes off. I should just do this barefoot. Then you guys are going to have to scoot farther back. But anything used in place of a curative conventional treatment is always a concern. If there's something out there that we know for sure is going to cure you, then doing the alternative route is maybe not the best idea. But certainly, I like when people are needing medications, you don't have to say pick just medications or just the alternatives. You clearly can use things together, and sometimes use less medications when you blend things, for example. So just a word about detoxification, because I think a lot of times the alternative medicine world is very hot on this concept of detoxification. And I like to remind people, from my point of view, if you really want to be natural about it, let the body do what it's really good at. So we've evolved into being great detoxifying organs. So our lungs, our skin, the liver, the kidneys, the colon, they're all detoxifying organs. And if you support them by eating well and not putting a lot of toxins in the first place, and staying well hydrated and exercising, you're going to keep that detoxifying system running pretty well on its own. So lifestyle medicine, as I mentioned, this is one of my favorite things to talk with patients about because it does give some control back to the patient. It's low cost or no cost. And not only might you be addressing whatever concern you came in to see me with, but you can also help other issues, maybe high blood pressure, or you have a family history of early Alzheimer's or something like that. These lifestyle approaches can be helpful there too. And so I'm talking about working on good sleep, exercise, mind, body, and nutrition. So just, about one slide on each of these. So first of all, get some sleep. So we know that when you get a good night's sleep, pain is better, mood is better, fatigue is better. How many people agree with that? So I think we've all experienced that. And then they've taken it a step further, and they've done controlled experiments where they take a group of normal people, and I have to put normal in quotes because the one study I'm thinking of, they use third-year med students, and they're not so normal. But if you sleep-deprived third-year med students for 36 hours, they all get kind of achy all over in a syndrome that looks very much like fibromyalgia, which many of you may have heard of, a chronic pain syndrome. And there have been links to poor sleep over years and years, and weight gain, and breast cancer as well. So, I do have to point out this little girl here. She's now 17, but none of my kids have been that cute since. Even though you can see one of them who told me not to point her out in the corner. Sorry, Alice. So some things you can do for yourself, the behavioral approaches, this is what I call the grandmother tips. So this is what your grandmother would have told you if you said, Grandma, I can't get a good night's sleep. But I bet you everybody can find one thing on that list that actually is like, oh, that makes total sense. I hadn't thought of it before. So I always like to go through those with people. And then also to highlight that we have a sleep clinic at University Hospital that works not on sleep apnea and kind of those sort of sleep disorders, but works with people who are bothered by nightmares or just chronic insomnia, just can't figure it out. They're a great resource. So I often will work closely with them as well. And then other things that you can do, relaxation, mind-body techniques, cognitive behavioral therapists can be very helpful. In the sleep clinic at university has a nurse practitioner that does cognitive behavioral therapy just for sleep. Yoga, Tai Chi, acupuncture, supplements. I'll just make sure you guys are awake. Melatonin, and I put the exclamation point there because it's quite a wide dosing range. Some people 1 milligram is plenty. Other people up to 20 milligrams to get a good night's sleep. I'd say commonly is around 3 milligrams. Valerian is also out there for sleep, and as long as I'm throwing a few herbs in here, I want to dissuade people from using valerian because it's very much like Valium. And I would actually rather somebody use, Valium when I know exactly what they're going to get than something where they might not know exactly what's in the tablet. So a little bit on exercise, so benefits of exercise, and all these things kind of go together. Yeah, can someone spot me? You guys saw the cartoon there, the empty Dalmatian. So, sleep, if you're sleeping well, you want to exercise. If you're exercising, you're going to sleep better, you're in a better mood. If you're in a better mood, you're more likely to sleep better and consider exercise. So they all play off of each other for sure. So exercise helps sleep, helps depression, anxiety, overall health. There's some things that are obvious. You've all are aware that exercise can help blood pressure, it can help cholesterol, it can help keep your bones strong, help your blood sugar, but actually can help decrease pain in arthritis, which is kind of counterintuitive, I think, because the more you use your joints, sometimes the more they hurt. But if you use them enough and use them in the right way, it can actually make arthritis pain better. It can be helpful for hot flashes. So research has shown that people who exercise tend to have less hot flashes in women going through menopause than people who don't. It's one of the cornerstone treatments for chronic fatigue and for chronic pain, but probably talking to somebody who understands those conditions, so you do enough but not too much. Decreases the rate of a lot of cancers. Exercise and body weight for sure are two of big factors that are a little bit more controllable as far as cancer risk goes. And can improve immune function. I'm always getting questions from patients, what supplement can I take to improve my immune function? And my favorite supplement is exercise. And how many of you have done pulmonary rehabilitation? So a couple of people. So with lung disease, pulmonary rehabilitation is not only exercise, but also a lot of education and breathing techniques and nutrition, and a wonderful, wonderful resource. So you need strong medicine to relieve your stress. I'm prescribing a puppy. Great idea. I agree. I'm going to get some kittens for the office. Yeah, so I'm going to talk about mind-body therapies, and there's a whole host of things that would fall under the umbrella of mind-body therapies, including cognitive behavioral therapy, relaxation techniques, breathing techniques, stress management skills, biofeedback and different types of biofeedback, mindfulness, imagery, visualization, yoga, tai chi. So at the end of the talk, we're all going to do this yoga pose. Get ready.
You'll have to help.
Yes. So if you're learning some new mind-body skills, it's different than what you might think of when you're working with a psychologist. So a lot of people think if you go into therapy, you're going to be lying on the couch and talking about your childhood and your relationship with your mother, but in health behavior psychology, it's much more concrete, goal-oriented, skills-based kind of work. So oftentimes 5 to 10 visits is enough. You learn a skill, you go home, practice, you come back, you build on what you've learned, and at the end of 5 or 10 visits, you've got all new tools in your toolbox. And I heard there was a question last session about marijuana, and I get that question a lot as well. And I think part of the benefits of marijuana is it helps people relax, but you can't take it across the border. Here's something you can take across the border. Just saying, this is much easier to get by TSA. And another benefit of mind-body therapies is it's often covered by insurance. So if you find a health behavior psychologist, oftentimes that's going to be covered by insurance. I know there are people from out of town and people who live maybe rurally who wouldn't have access to a health behavior psychologist. If pain is an issue, I've got the name of my favorite pain book. It's called Managing Pain Before It Manages You, and it's kind of a workbook that works people through a cognitive behavioral approach to pain management in particular. So there are some other resources there. So I like to highlight mind-body for stress reduction, for shortness of breath, for fatigue management, for help with sleep, for behavior change. I know I need to stop smoking, I'm having some trouble. Health behavior psychology is a great resource. And adjusting to chronic illness. So our psychologists at Integrative Medicine, I would say probably 80% of the folks that they work with have some sort of chronic illness. And so the focus of the work is learning skills that can help with symptom management for that illness, but also kind of help with redefining yourself sometimes and being comfortable and happy with whatever the current status of normal means. And I did want to highlight the rest of the afternoon. We've got talks that do address more the mind-body side of things. So I think that's great that those guys are on the agenda. And it also allows me to cut my talk a little shorter. So now we'll get into and any questions on lifestyle therapy? Or yes, so I have to say I have a different impression of what Reiki is all about. Before we move on, any questions about sleep or exercise or mind-body? Nutrition is one I didn't mention just for the sake of time. But nutrition, I mean, food is medicine is really a thing, for sure.
This is
Yes.
a question, but I used to work in prisons and jails, and people that have to sit or lie down most of the day also have trouble sleeping. Because the body thinks it's slept, but the mind.
Did you guys hear the comment? So she worked in prison and she was made to jail and made aware that, she recognized that people who are sitting and lying most of the day have sleep issues. Just not a natural thing. Yes?
I just find it kind of confusing to me. All kinds of things say it boosts your immune system.
Yeah.
And most of us are on immunosuppressants, so
That is a really good point. So the comment and question was, all these things are supposed to boost your immune system. Is that always a good thing? Because with scleroderma and a lot of other autoimmune illnesses, you're on, immunosuppressants because your immune system is the enemy. Yeah, so I think, I have not seen any evidence. We know that exercise boosts the immune system, but the way that exercise boosts the immune system is just really by helping the white cells be more effective. And I don't think, that's the same part of the immune system that is trying to be suppressed with the immunosuppressants, for example. But I do think, echinacea, for example, that's a common remedy out there for colds and flu, which looks, in some studies, has shown to be effective, but it's felt to be an immune stimulant. And so maybe that one in particular, there's sort of general advice if you're trying to suppress the immune system, that, for example, may not be the greatest supplement to take. Other questions? So get into the fun stuff now. The stuff you thought I was going to talk about 15 minutes ago, right? Any score updates?
Yes, the Browns are ahead by 20 to 16.
Oh, she's not sad about having heard that. 20 to 16 Browns. Okay. So speaking about herbs, what herbs should I drink to help me sleep? That depends on whether or not you want to wake up again. So once again, stressing that just because it's natural doesn't mean it's safe. So I like to think of herbs and supplements as being on the spectrum of medications. So there are things you need to get a doctor's prescription to be able to access. There are things that have been deemed to have a good enough risk-benefit ratio that they're sold over the counter. And then there's kind of this lump category of dietary supplements. So unlike prescription and over-the-counter medications, if the product's a dietary supplement, it means that it really doesn't have to prove itself safe or effective before it's sold. And the burden of proof is on the FDA to pull something off the market by showing that it's not safe or not effective, and they certainly have bigger fish to fry. So I believe ephedra is about the only thing. There's one other that I'm blanking on right now, but ephedra is pulled off the market. But there's a lot of things out there that, maybe are just bopping along under the radar. So people think over-the-counters and dietary supplements are in the same category, and they're really quite different. And there is now a requirement that if you are manufacturing dietary supplements, you do have to follow good manufacturing practice. But the burden of proof is still on the FDA to say, hey, you're not actually following good manufacturing practice. So you can get a lot of variability among supplement products. And a reminder, just because it's natural doesn't mean it's safe. Be cautious with potential drug and supplement interactions. Use good resources for information, and if you're choosing to take a supplement or recommend a supplement to a friend, look for well-labeled brands. So I like this USP symbol here. This makes it pretty easy. So USP is the United States Pharmacopoeia, and they set the standards of strength and purity for prescription and over-the-counter products already, and they have a dietary supplement verification program. And it's basically like Consumer Reports. They'll go pull off supplements off the shelf and test them, and if they meet their standards, then the supplement can put USP on the label. So this is not a brand itself, but it's kind of the good housekeeping seal of approval. So if you see that, it means that the product has the ingredients it says it does. It's in a form your body could use. It has been made according to good manufacturing practice, and there are no contaminants. So I always tell people, if you're going to take a supplement, look for something that has USP designation that's as cheap as you can get it. So you don't have to spend an arm and a leg. If you see the USP, it's a good quality product. And then make sure that I also recommend that people avoid combination products for the most part, because if there's 20 ingredients in there and you have a reaction, don't know what you're reacting to. Multi-level marketing, I think, is just slightly unethical, even though some of the products may be okay. Make sure you tell your doctors and pharmacists if you're taking supplements. And general recommendations around elective surgery are to stop everything about 2 weeks prior, because a lot of herbs and supplements may make it a little bit harder for your blood to clot or interfere with anesthesia. So if you have that luxury of time, it's, you know, just a general recommendation. Did I see somebody had a question, perhaps?
Got a question?
Yeah.
So which resources do you recommend that you refer patients to get information on supplements?
So resources for supplements, and they're on the back, the very end of the talk in the slides there are some resources, but FDA, Office of Dietary Supplements is one. The National Institute of Health, it used to be the National Center for Complementary and Alternative Medicine, now it's the National Center for Integrative Medicine and Health. They're a good resource. There's the Natural Medicines Comprehensive Database, which is my favorite resource, but it's subscription. Luckily, the hospital subscribes. But individuals, if you really were wanting to geek out on supplement information, you can go to the Health Sciences Library on the main campus and go to town on the computers in the lobby there and have access to natural medicines for free. Any other questions? Okay. So herbal remedies versus verbal remedies. Snap out. That's a good one. So here's that, and I don't get any money from any of these people, but just to show you, you don't have to pay an arm and a leg to get a good quality supplement. And this also is to point out the, let's see, point out the little USP sign on the label.
Oh, I see it.
Oh, I'm sorry, I can't.
I see it.
She sees it, it's like an Easter egg hunt, and I'm afraid if I jump off the stage, it's gonna be tragic. So basically, the tiny USP symbol down next to the blue sign. So sometimes you have to look a little hard. You guys see the USP symbol? Yeah. Okay. Do you take supplements on a regular basis? How many say yes? And coffee's not included. No. So quite a few supplement takers. Here's the ones that are kind of on my quick hit list of things that I think are either really not proven beneficial, that are fairly common that people might take, or are felt to be harmful. So vitamin E is one that I still see a fair amount of people take, because 20 years ago it was all the rage for heart disease. Well, the research says that you might actually have higher mortality with vitamin E. B-complex vitamins, kind of the same thing. St. John's wort actually works for mild to moderate depression, but it has a ton of drug interactions and makes people photosensitive as well. And it may be doing some damage to DNA, some lab studies have shown. So I prefer that people don't take that one. People often are taking, instead of like hormone replacement therapy, they say, oh, I'll take the phytoestrogens because those are safer, but if they're stimulating the estrogen receptor, they're still stimulating the estrogen receptor. And multivitamins, I mean, I think if your diet has fruits and vegetables in it, that is just one cost savings that you can make every month. Because I think multivitamins, for the most part, are just creating expensive urine. And so I went from poop to urine. It's like a good day. So, generally, I say as much as you can get through diet, that's great. But there are definitely times that you may need a little extra calcium. Of course, calcium is now controversial, because calcium supplements slightly increase the risk of heart disease, whereas dietary calcium decreases the risk of heart disease. But calcium is good for your bones. So if you've got bone concerns, you're on prednisone for a long time, you've got bone concerns. So take as much calcium as you need, but get as much from diet as you can. So don't take more than you need, basically. And omega-3 fatty acids, great anti-inflammatory, and lots of benefits. The research keeps coming out. Everybody needs vitamin D. It's maybe 1 out of 50 people that'll check the vitamin D levels where it's normal and they're not taking a supplement, and they're wearing sunscreen. That's pretty uncommon. And maybe we should all consider probiotics. I think the research there is interesting. And then I figured this audience might be interested in Raynaud's, and there is a little bit of research out there for ginkgo, fish oil, and inositol. So just some things to think about and maybe ask your physician about if you want to give those a try. Acupuncture, so there's different ways of looking at acupuncture. There's Chinese medicine, which views health as a balance between these two oppositional forces called yin and yang. So one's masculine, the other's feminine, one's light, the other's dark, one's wet, one's dry, that kind of thing. And they're felt to be necessary for each other, and they create an energy by by interacting together, that energy is called qi. And in traditional Chinese medicine theory, you run into problems if your yin and yang are out of balance, or if you have not enough qi, too much qi, or if your qi is not flowing well. So some examples, that we've got the traditional Chinese medicine docs in our office, and so they'll write these diagnoses down: yin deficiency, yang predominance, reduced kidney qi, which I think is kind of funny because the rheumatologists are reading these notes and going, wow, I thought my patient had scleroderma. Guess I better go back to the books. And then some of them are just kind of entertainingly descriptive, like stomach chi rebelling, which I always get a little bit of stomach chi rebelling before I give a talk. But acupuncture is not just putting needles into people. There's other things here, so they'll often recommend herbal remedies. They'll do a special kind of massage called Tui Na, which also is based on these meridian principles and qi principles. They may use cups on your back and burn a little herb called matza under there to create suction, or just use a suction device. They may put acupuncture needles in your ear, and they may do a little bit of foot acupuncture or acupressure rather as well. So traditional Chinese medicine is all of that, not just the acupuncture. And then Western medicine got interested in acupuncture. It's kind of urban legend that we didn't know anything about acupuncture until James Reston, who was a reporter with Nixon, traveled to China, needed an appendectomy, had acupuncture, and was really impressed and came back and wrote about it. So that is true, but you can go back as far as the father of modern medicine, Sir William Osler. He said it's the best treatment for low back pain. But then if you actually read the textbook, which I did because I was curious, he was talking about sticking a hat pin in the back where it hurt. And so I'm thinking everybody gets cured with that kind of acupuncture because you're never going back. And we know as doctors, if you don't come back and see us, it's because we cured you, obviously. But Western medicine has looked at this Chinese, ancient Chinese thing and said, golly, yin yang, that's hard to kind of wrap our heads around. But they found Western measurable things that acupuncture does. They found that there's local nerve activation. They found areas of the brain that perceive pain are kind of toned down a little bit when you have acupuncture. It can help with the immune system as well. And they've done functional brain scans and show what happens when people are having acupuncture. So there's some good Western science behind why might acupuncture be helpful. And I'd say it's generally safe. There's nobody out there who's contraindicated from having acupuncture from a safety point of view. Some people may get a spot of blood if you're on a blood thinner, or if you have a coagulation problem, you may get a little spot of blood or a bruise where you wouldn't if you weren't on Coumadin, for example. Fatigue is an interesting thing because fatigue in Chinese medicine is felt to be good. So if you get the acupuncture and you're like, oh, that's a good response. So I think there are a few people out there who probably shouldn't drive home after having acupuncture. And a lot of people can practice acupuncture. If you go to traditional Chinese medicine, you're going to get somebody who's had years of training. If you go to the physician or the chiropractor, they haven't had quite as much training most of the time. So my bias is typically with the Chinese medicine provider. And the costs are variable, but some insurances are starting to cover acupuncture. So if you're comfortable sharing, I've asked you questions without asking you if you're comfortable, but who's had acupuncture in the room? Wow, quite a few people. Okay, so again, all the acupuncture questions are going to go to them. So what's acupuncture good for? So on the plus side, dog versus porcupine, you cured my back pain. So I like to think about acupuncture for acute and chronic pain, for nausea, and pretty much any kind of nausea. It's been pretty well studied. For other gastrointestinal issues, in this audience, I'm betting there's a lot of folks out there with reflux as a concern. Irritable bowel syndrome can respond as well. It can be helpful for fatigue and certainly helpful for different women's health issues. So massage therapy, developed by almost all cultures because it's kind of natural to rub something that hurts. And all types of massage therapy are emphasizing improving your circulation and relaxing the patient and releasing muscle tension. And massage is generally safe. And again, this is a place I think nobody is contraindicated from having a massage. But the more medical conditions you have, the more you want to see a medical massage therapist rather than the corner massage shop. So somebody who is familiar dealing with different issues with fragile skin, with people on blood thinners, with people with osteoporosis, for example. And you want to be cautious with heart failure because massage is great at returning fluid to the circulation, but if your heart's not able to pump it forward, then it can wind up in your lungs. And so there have actually been case reports of people who have died after massage therapy from heart failure. But if your heart's fine, that's not a concern. If your heart's not fine, that's okay as long as you go to a medical massage therapist who knows that the goal of the massage isn't going to be to get rid of all the edema. So how do you find a medical massage therapist? If they're involved with the American Massage Therapy Association, if they have national certification, I think that's one good way, but certainly having a conversation with people. And highlights for massage: stress reduction, relaxation, sleep, pain, post-operative healing, lymphedema, chronic constipation can be helped, relaxation and improved quality of life. Skin, I put some question marks because I was curious, but I couldn't find any research on that. So how many massage therapy people, how many people have tried massage?
Once a week.
Once a week, we've gotta convert, yes, so almost, I think, maybe more people with acupuncture than massage. And some people say they find that acupuncture is more relaxing even than massage therapy. Oh, that video, shoot, I don't think that video, I didn't link it up right. I won't even try to describe it to you. Go to YouTube and look up boat lady yanked off dock. And you'll see why chiropractic was probably in her future. Because it's 5 seconds long, but I forgot to put the link. But to talk briefly about chiropractic, you can go also back to Hippocrates and Galen and find references to manipulation of the spine. But it really didn't take off until the late 19th century, where this guy, D. Palmer, said, wow, think about it, the brain is here, the spinal cord sends signals to every organ and every part of the body, so if you can just keep that spinal cord straight and keep those nerves from being impinged, you can cure everything. So that was his philosophy. But now you find there are some people who still ascribe to that philosophy, and there are other people who say, really what we're doing is helping musculoskeletal issues. And so I tend to think that there's a lot of things that chiropractic can't cure, so I don't think it's the cure-all, but I think for musculoskeletal issues it can be quite helpful, and so my bias is to find somebody who thinks more along the musculoskeletal side of the spectrum rather than you can quit your insulin and stop your cholesterol medication because we're going to fix it with chiropractic. And some insurances, and Medicare being one of them, do cover chiropractic therapy. Here's an area, though, where I think there are some people who should not get chiropractic. So if you have osteoporosis, if you have rheumatoid arthritis, if you've had a stroke, no need to go to a chiropractor. If you happen to stumble into the office of our chiropractor, he's going to show you some exercises and some stretching things that you can do, but probably would refer you to physical therapy. You don't need somebody who's taking you beyond your sort of normal range of motion when you have those kind of conditions. Because though it's rare, you can dislocate things, you can fracture things, and you can cause strokes with chiropractic manipulation. So here's one thing where even though all 50 states require you to have a DC, a doctor of chiropractic, people's philosophies are really all over the map. So you can't just look at that terminal degree and know what you're going to get with the chiropractor. So I really encourage people to have a discussion with their chiropractor. Any chiropractors in the audience? Because you're going to answer all my questions. Okay. So highlights for chiropractic: neck pain, back pain, headaches, musculoskeletal issues, not curing cancer, not curing diabetes, for example. But I do like this cartoon. Whoa, what's a joint like this doing in a girl like you? Chiropractor, pick up lines. So I thought I would just sort of summarize things by thinking about what are some of the common symptoms that go along with scleroderma in its different forms, and what might be the integrative approach. So just kind of one slide to hit the highlights. And you can see already that I put lifestyle approaches for everything, because I think there are lifestyle approaches that can help pretty much any symptom. But if you look on the list, fatigue, in addition to lifestyle approaches, might consider a trial of acupuncture. For pulmonary symptoms, things that can help you stop smoking, there's definitely some alternatives that could help in that arena. And then the mind-body, just for pulmonary symptoms for sure. Pain, pretty much everything I've talked about, there's a reason to try a different alternative therapy. For strength, lifestyle approaches, vitamin D is really important in muscle strength. Sleep, we talked about some of the ways to approach that. Raynaud's, we talked about some of the ways to approach that as well. And GI symptoms, acupuncture, traditional Chinese medicine herbals might be helpful there as well. And I skipped the stiff joints, but acupuncture and massage can be helpful for those sort of symptoms. So how do you find a good practitioner? Of course, I want you guys to all come and see me and see all my colleagues, but I realize that's not practical for everybody. And so what you do is you get word of mouth referrals. That's just a good place to start, or ask your doctor and they may be able to refer you as well. But then once you get that referral, ask the person, how were you trained? Do you have a license? What's your experience with scleroderma, with Raynaud's, with GERD? You know, what's your experience with the symptom? And then just keep your BS meter on, and if they say, I cure 100% of people, then, you know, that's probably not the right provider. Or if they say, I've never heard of that, that's probably not the right provider either. So somebody who says, yeah, I've worked with 1 or 2 people, and I've had some success, you know, that's somebody who, you know, is being honest with you and is right there, meets my standards. What are the benefits? What are the risks? How much does it cost? How are we going to assess how well I'm doing? And maybe most importantly, are you okay with me continuing my insulin and my blood pressure medicine? You know, is it okay if you send a note to my providers, and can they copy you on their notes, and can we be integrative? So what the health? So integrative medicine is the coordination of lifestyle approaches, complementary alternative medicine approaches with conventional care. And just briefly, stay away from the harmful things, use the safe and beneficial things, consider the things that are at least plausible and safe, and don't just skip over all the good stuff that's to be gained from lifestyle approaches. Find good providers and use good information resources, which are, I think, the last 3 slides. And be open-minded, but not so open-minded that your brains fall out.